Hi, occupational therapy students. I know that sometimes studying can be really difficult. And before we get into how to break down questions for a neuro question for the OT exam, I want to remind you that if it wasn't hard, everyone would do it. It's the hard that makes it great. So when you're studying, try to think of something motivational or inspirational as you study and try to keep that in mind. Try to keep that positive thinking going. So now we'll get into breaking down a question for neuro, which is in Module 5 of PASA OT. And remember to simply fill in the blanks or write it down on your whiteboard. And remember the mnemonic, read with diligence and patience before answering. So remember to read the question carefully. So let's read this question really carefully. Sometimes you're going to come across a question that can be lengthy. So we'll try to figure out what are the main points. A 67-year-old female inpatient who was diagnosed with a mild right CVA demonstrates deficits with her balance. The current goal of OT intervention is to improve the patient's postural control during functional task performance. Today's session is structured to encourage active trunk rotation and functional use of her upper limbs bilaterally. The patient is participating in a laundry folding activity, which requires her to fold towels on a table which has been placed to her left side, and then to place the folded towels on another table, which has been placed on her right side. Initially, the patient sits on the edge of her chair, and when rotating her trunk, the OTR observes that the patient requires moderate use of both her upper extremities for support. In what position should the OTR encourage the patient to sit to maximize the use of her upper limbs in this activity? So after you read the question carefully, we want to really think about, okay, where are we in the OT process? So we know we are in the intervention stages, and we want to think about the diagnosis or the disease. So we know it's a mild right CVA and it's non-progressive, so they will get better. And so what is a patient's problem or performance or function, or what symptoms are they experiencing? We want to think about what is the question asking in regards to goals. So we know that the question is referring to a poor balance and that the patient relies on using arms to help with balance. The goal is to improve the patient's postural control during functional task performances. So we want to think about next is what's in bold or in caps, or what is the question specifically asking. And the question is specifically asking, how should the therapist encourage the patient to sit during the laundry folding activity so that the patient does not need to use her arms to help her balance, and she can therefore have the freedom to use her hands for the actual task of folding the laundry. So now let's get into the answer choices. And when we look at the answer choices, we want to keep in mind the problem, question, or goals. Is this addressing the problem, questions, or goals? Is this a functional activity? Okay, so now let's get at the answer choices. A, provide anticipatory support with a therapist seated behind the patient. B, continue folding the towels with the patient's arm supported on a small table placed in front of her. C, complete the laundry task by having the patient sit all the way back on the chair. D, substitute core activation by lying on a mat. Well, we know that A is not correct, so we can definitely cross that off right away, because A, it continues to facilitate anticipatory postural movements, but does not change the demand on stability. And B is not correct because it compensates for need to continually use upper extremities to support posture. However, reduces the challenge for trunk control and does not meet the goals of intervention. D is incorrect because it compensates the need to continually use upper extremities to support posture. However, reduces the challenge for trunk control by 100%. Therefore, the correct answer is C, which completes the laundry task by having the patient sit all the way back on the chair. The patient continues to require adjusting her posture with trunk rotation, but with more stability due to increased space of support. I want to remind you that in addition to the most extensive online course available, PASA OT prides itself on our passionate and dedicated tutors, each being instrumental in helping our students pass the OT exam through their one-on-one sessions and group tutoring. If you need any further assistance, please send us a chat message at pasaot.com, and we can also provide you with a customized schedule. Good luck with your studying.